Today we move into Chapter 2, Ethical Theories. This chapter is about the different frameworks we can use to think about right and wrong in healthcare. While Chapter 1 introduced us to principles like beneficence and autonomy, this chapter asks why we think those principles matter and how we justify them. We'll look at two big areas: meta-ethics, the study of what morality actually is, and normative ethics, the study of rules and principles for how we should act. Together, these give us the toolkit we need to make sense of tough moral dilemmas in healthcare. Meta-ethics. Asking the big questions. Meta-ethics digs into the foundation of morality. It asks questions like, are moral values universal, or do they depend on culture? When we say something is right or wrong, are we stating facts or just expressing feelings? Key views in meta-ethics. 1. Moral realism. Morality exists objectively, independent of human opinion. For example, many argue that causing unnecessary harm is always wrong, no matter the culture or time period. 2. Anti-realism. Morality is not fixed. It depends on human beliefs, emotions, or cultural norms. For instance, end-of-life practices like assisted dying may be considered moral in one society but immoral in another. 3. Cognitivism. Moral claims can be true or false. Saying lying is wrong is making a claim about reality. 4. Non-cognitivism. Moral claims express attitudes rather than facts. Saying lying is wrong is like saying, I disapprove of lying. When we turn to meta-ethics, we step back from debating specific actions and instead ask deeper questions about the nature of morality itself. What do we mean when we say something is right or wrong? Is morality something real and universal, or is it shaped by people and cultures? There are 4 major views that help us think this through. The first is moral realism, which argues that morality exists objectively, independent of human opinion. In this view, moral truths are like scientific facts. They are true whether or not people agree with them. For example, many would claim that causing unnecessary harm is always wrong, regardless of the time, place, or cultural context. Just as gravity does not change depending on belief, moral realism suggests that certain ethical principles remain constant. In contrast, anti-realism denies that morality is fixed in this way. According to anti-realists, moral values are constructed by humans and influenced by culture, society, and emotion. This means that what one community calls moral, another might call immoral. End-of-life practices illustrate this clearly. In some cultures, assisted dying is seen as a compassionate and moral act, while in others it is considered ethically unacceptable. Morality here is not absolute but relative. The next distinction in meta-ethics is between cognitivism and non-cognitivism. Cognitivists believe that when we make moral claims, we are stating something that can be true or false. If someone says lying is wrong, they are making a factual claim about reality that can be supported or challenged. Non-cognitivists, however, argue that moral statements do not describe facts, but express emotions, attitudes, or commands. Saying lying is wrong is less like stating a fact and more like saying I disapprove of lying or don't lie. From this perspective, morality is about how we feel and communicate, not about objective truths in the world. Together, these views in meta-ethics help us understand that even before we argue about what to do, we need to ask a deeper question: what does morality itself mean? 2. Normative ethics, setting rules for action. Normative ethics is about practical guidance. What should healthcare professionals do in real situations? Major normative theories. 1. Utilitarianism. Consequentialism. Oh, the right action is the one that produces the greatest good for the greatest number. Oh, healthcare. Example: in a pandemic, hospitals may allocate ventilators to patients most likely to survive, maximizing lives saved. O, strength, focuses on outcomes and overall well-being. O, limitation, may sacrifice individual rights for the greater good. One of the most influential ethical theories in healthcare is utilitarianism, also known as consequentialism. At its core, utilitarianism argues that the right action is the one that produces the greatest good for the greatest number of people. Instead of focusing on duties or rules, this theory looks at the outcomes of actions. If the overall result increases well-being and reduces suffering, then the action is considered ethical. In healthcare, utilitarian thinking often emerges in times of scarcity or crisis. For example, during a pandemic, when ventilators are limited, hospitals may allocate them to patients who are most likely to survive and recover. The goal is to maximize the total number of lives saved, even though this might mean not treating every individual equally. In this way, utilitarianism prioritizes the bigger picture of community well-being over individual claims. The strength of utilitarianism is its practical focus on outcomes. It pushes healthcare professionals to think about the broader consequences of their choices and to aim for the greatest overall benefit. This makes it a useful framework in public health, where decisions often affect large populations. However, utilitarianism also has important limitations. Because it emphasizes the greater good, it can sometimes overlook the rights or dignity of individuals. A decision that benefits many may still cause serious harm to a few. For instance, denying treatment to one patient in order to help several others may be efficient, but it can feel unjust or even cruel at the individual level. This tension makes utilitarianism both powerful and controversial. It provides clear guidance for maximizing well-being, but it also raises questions about how much we are willing to sacrifice individual rights for collective outcomes. 2. Deontology, duty-based ethics. O focuses on duties, rules, and respect for persons, regardless of outcomes. O based on the philosophy of Immanuel Kant. Treat others as ends, not means. O healthcare. Example, always telling the truth about a diagnosis, even if it may upset the patient. O strength, protects individual rights and dignity. O limitation, can feel rigid when rules conflict. Another major ethical framework is deontology, often called duty-based ethics. Unlike utilitarianism, which looks to outcomes, deontology emphasizes the importance of rules, duties, and respect for persons, no matter what the consequences might be. This theory is rooted in the philosophy of Immanuel Kant, who argued that humans should always be treated as ends in themselves, never merely as means to an end. In other words, people must never be used or manipulated for the sake of convenience or efficiency, even if it would produce good results. The moral worth of an action lies not in what it produces, but in whether it is done out of duty to what is right. In healthcare, this often means that professionals must uphold principles of honesty, respect, and fairness even when doing so may cause discomfort. For example, deontology would require a physician to tell the truth about a diagnosis, even if it is painful or frightening for the patient to hear. The duty to be truthful and respect the patient's autonomy outweighs the potential benefit of sparing them temporary distress. The strength of deontology is that it safeguards individual rights and human dignity. It ensures that patients are not reduced to numbers in a calculation of greater good, but are respected as persons with intrinsic worth. This makes it particularly important in contexts like informed consent, confidentiality, and patient autonomy. However, deontology also has limitations. Its commitment to rules and duties can feel rigid when principles conflict. For example, a doctor may feel torn between the duty to tell the truth and the duty to prevent harm if disclosing information could cause extreme distress. Deontological ethics does not always provide a clear solution in such cases, making real-world application challenging. 3. Natural law. Theory o morality is grounded in human nature and rational order. O certain actions are always right or wrong, often linked to ideas about the sanctity of life. O healthcare. Example, opposition to assisted suicide or abortion on the grounds that life must be preserved. O strength. Provides clear guidance rooted in universal human goods. O limitation. Can clash with modern values of autonomy and personal freedom. Another important framework in healthcare ethics is natural law theory. This tradition argues that morality is grounded in human nature and rational order. According to natural law, the universe has an inherent structure, and human beings, by using reason, can discover the moral laws built into that order. Actions are right when they align with human flourishing and the purposes of nature, and wrong when they contradict them. In practice, natural law emphasizes that there are universal moral truths that apply across all cultures and times. For example, the preservation of life is considered a fundamental good. This means that acts which intentionally destroy innocent life, such as murder or certain forms of euthanasia, are inherently wrong, regardless of the consequences. In healthcare, natural law often influences debates about life and death issues. For instance, many who oppose assisted suicide or abortion appeal to natural law, arguing that human life has intrinsic value and must be protected from conception to natural death. From this perspective, even if ending a life might relieve suffering or benefit others, it would still be morally wrong because it violates the natural purpose of life itself. The strength of natural law is that it provides clear, universal guidance rooted in shared human goods like life, health, knowledge, and community. It offers a moral anchor that does not shift with cultural trends. Yet, its limitation is that it can sometimes clash with modern values of autonomy and personal freedom. For example, a patient may wish to end their suffering through assisted dying, but natural law would forbid this choice on the grounds that life must be preserved. Critics argue that this can feel restrictive in a pluralistic society where individuals may not share the same view of natural purposes. 4. Virtue. Ethics focuses on the moral character of the professional, not just rules or outcomes. Healthcare. Example, a compassionate nurse who takes extra time to comfort a patient even when it isn't required by policy. Strength, humanizes healthcare, builds trust. Limitation, less specific guidance in complex dilemmas. The final major framework we consider is virtue ethics. Unlike utilitarianism, which emphasizes outcomes, or deontology, which emphasizes duties and rules, virtue ethics shifts the focus to the moral character of the healthcare professional. It asks not just, what should I do, but also, what kind of person should I be? Virtue ethics teaches that good healthcare depends on cultivating personal qualities, or virtues, that shape behavior in meaningful ways. Qualities like compassion, integrity, honesty, humility, and courage allow professionals to respond to patients with wisdom and humanity, even when rules or outcomes don't provide clear direction. For example, imagine a nurse caring for a patient in severe distress. While policy may not require the nurse to spend extra time at the bedside, a nurse guided by compassion will choose to stay and comfort the patient. This act is not about following a rule or maximizing utility. It is about expressing a character shaped by virtue. The strength of virtue ethics is that it humanizes healthcare. Patients often remember not just the treatment they received, but the kindness, patience, or integrity of the professionals who cared for them. By fostering virtues, healthcare providers build trust and deeper therapeutic relationships. However, virtue ethics also has limitations. It can sometimes feel less specific when dealing with complex dilemmas. For instance, in a case where two ethical principles conflict, such as autonomy and beneficence, virtue ethics does not always offer a precise rule for what to do. Instead, it relies on the professional's character and judgment, which may vary from person to person. In this way, virtue ethics serves as a complement to other theories. While rules and outcomes provide structure, it is virtue that ensures healthcare remains compassionate, trustworthy, and deeply human. Third, theories and practice, blending frameworks. While each ethical theory provides valuable insights, the reality of healthcare is that no single theory can solve every ethical problem. Real-world situations are often too complex for one framework to capture completely. This is why healthcare professionals frequently blend approaches, drawing on the strengths of different theories depending on the situation they face. For instance, utilitarian reasoning is often used when allocating scarce resources. In a public health crisis like a pandemic, hospitals may need to decide how to distribute ventilators or vaccines. Utilitarianism helps by focusing on outcomes, saving the greatest number of lives or reducing overall suffering. It offers a way to think about fairness in terms of maximizing benefits for the community. At the same time, professionals also rely on deontological duty, especially when it comes to patient rights. Deontology ensures that rules like informed consent are respected, even when doing so may not lead to the best outcome for everyone. A physician may believe that withholding information could reduce distress, but deontology requires honesty, transparency, and respect for the patient's autonomy. Beyond rules and outcomes, virtue ethics plays a critical role in daily interactions. Small acts of compassion, integrity, and empathy build trust and reassure patients that they are valued as people, not just cases. For example, taking extra time to listen to a patient's fears is not dictated by strict duty or by calculations of utility, but by the character of the caregiver. The challenge for healthcare providers is learning when to lean on which theory and how to balance them. Often, multiple principles apply at once, and professionals must weigh them thoughtfully. Consider this example. A patient requests access to an experimental treatment. From a utilitarian perspective, approval may be justified if the treatment has the potential to benefit not only the patient, but also the broader community through research findings. From a deontological perspective, the central concern is whether the patient receives full disclosure about risks and whether their consent is informed and voluntary. From a virtue ethics perspective, the provider's responsibility is to approach the situation with compassion and integrity, supporting the patient with honesty and care regardless of the decision made. This case illustrates that in practice, ethical decision-making often involves blending theories, ensuring that care is guided by outcomes, grounded in duty, and infused with human compassion. Let's wrap up our talk. At this point, it's important to step back and highlight the key takeaways from our discussion of ethical theories. Metaethics asks the most basic question of all. What is morality, really? Is it an objective truth that exists beyond human opinion, or is it a human construction shaped by culture, beliefs, and emotions? Understanding this helps us frame every ethical debate. Building on that, normative ethics gives us the practical tools for decision-making. Different frameworks offer different ways of approaching moral choices. Utilitarianism emphasizes the consequences of our actions and seeks the greatest good for the greatest number. Deontology focuses on duties and rules, reminding us that some actions are right or wrong regardless of outcomes. Natural law points us to a universal moral order rooted in human nature and reason, and virtue ethics brings attention to the character of the professional, reminding us that compassion, honesty, and integrity are as important as rules or results. In real-world healthcare, no single theory is sufficient on its own. Ethical dilemmas are often too complex and layered. Providers must blend different frameworks, drawing on utilitarian reasoning when resources are scarce, relying on deontological duty when honoring patient autonomy, and practicing virtue ethics in everyday interactions that require empathy and integrity. The conclusion is clear. Ethical theories are not abstract ideas meant only for philosophers. They are practical tools that help healthcare providers think through the very real and often difficult choices they face each day. Whether it's deciding how to allocate limited resources, disclosing painful information, or balancing patient rights with professional duties. By understanding these theories and applying them thoughtfully, we can ensure that our decisions are not only consistent and logical, but also compassionate and just.